Mr. Pollack, let's bring you in. Now, the president, in his, quote, apology, said that these policies that folks like Steve and Kate and a lot of other people in the individual market have are subpar. You have called them Swiss cheese because you say there are so many holes in them. So explain to these two guys, after you've heard what they have to say, I know you don't know the details of their plans, but why this is a good deal for them.
So I don't know either Stephen or Cade's specific situation, but there's several things that actually are going to be significant improvements. So first, as you said, a lot of these policies are like Swiss cheese policies. They're insurance that doesn't insure. I'll give you two examples that are very significant. So many of these insurance policies have annual caps, or they may have lifetime caps on how much they will spend out if somebody has a major illness. Now, obviously, that's something people really want protection for. If they have a major accident or major illness, they don't all of a sudden want to be in a no insurance zone. So that's an area where these are subpar policies. But another thing that's really important here is that the vast majority of people who have private individual insurance, they will be eligible for substantial subsidies. For a family of four, like I think.
But wait a minute, you heard these guys say that it's going to cost them more, not less. We've heard stories like that across the country, Ron.
Yeah, clearly that for those people who are ineligible, say for subsidies, it could be that they would pay more. But these subsidies reach very deeply into the middle class, not just the poor. So for a family of four, I think Stephen was saying, for example, that he's a family of four. For those families, these subsidies reach all the way up to $94,200 in annual income. And these are thousands of dollars of subsidies. Now, not everybody has income below $94,000.
Steve, your reaction to that?
Ron, let me tell you something. We've actually done an extensive research on these premium subsidies, and if you really dig down to it, they aren't that substantial. Anything over 250% of the family poverty level, the subsidies go way down on the premium. And there's no cost-sharing subsidy under or over 250%. So when you say that there's going to be subsidies, it's just not there. And to also say that Swiss cheese, my policy had $3,500 deductible and then paid 100% of everything. There's only 4 things that it did not cover, part of the minimal essential benefits. That was maternity, pediatric dental, extra chiropractic benefits, and mental health care extra benefits. Other than that, it paid for everything.
No, let me just interrupt for a second, because this gets to one of the key points, and I think one of the reasons that people are so upset, Ron, and that is Steve happens to be a benefits specialist and a financial planner. He's pretty sophisticated in all this stuff. But whether it's him or whether it's Kate or whether it's anybody else, they've researched it. They've figured out their family finances and what their family needs. Why do they need you, or why do they need President Obama telling them what's good for them?
Well, they don't need me, that's for sure. But what they do need is to make sure they have insurance that truly insures. Now, I don't know Stephen's policy. I take him at his word that he's got what he thinks is good coverage. The overwhelming majority of people in the individual market have really lousy coverage. This is the wild, wild west of coverage.
Ron,
it is true. So most of the
for 25 years, and we don't sell a substandard policy.
Well,
I'm telling you, that's just not true.
Unfortunately, most people with private insurance, individual coverage, have substandard policies, and moreover, these policies currently deny coverage to people with pre-existing health conditions. They charge discriminatory premiums when people are sick. They terminate coverage when people get sick.
But again, and so these are I want to bring Kate into this. I mean, how do you feel? Because this is the argument. Here's Washington. Ron Pollack works with the administration, doesn't work for the administration, telling you what's good for you.
Well, Ron, I had a good policy that I was happy with. I did a lot of research in 2010, and it was affordable for me. And to get this letter in the mail, especially after the assurances that the president has given us, is just completely unacceptable. I'm a small business owner, as I said previously, and I've got other expenses that have to be met. I'm trying to help grow the economy by adding new jobs, and having to pay more for my insurance, that's going to limit me in that factor.
So one of the things that we've seen in the individual insurance market is that premiums have risen very significantly with each passing year. On average, in the individual market, they've increased 15%. There are a lot of insurers, all before the Affordable Care Act, that dropped out of coverage.
But you're not hearing
diminished.
these. But
no,
with all due respect, sir, you're not hearing these two guys
no,
who say
they're
quite happy with what they had.
I understand.
They're both small businessmen. One owns his own business, Cade. The other works in a small business. They like what they had, and they don't want Washington telling them what to do.
So, Chris, I'm not going to say, and I don't think the president is going to say now, that there aren't some people who may find that what they had before that they liked, that they don't have that anymore. That obviously the president's made that clear. For the vast majority of people, they do not have, they either don't have coverage. We got 48 million people in the country without any health insurance whatsoever. They can't afford it. They've been denied coverage by an insurance company.
And that's a worthy goal. The question is, do people like Steve and Cade, who pay their bills, who creating jobs, do they need to get messed over to solve the problem of the uninsured? Let me ask you specifically, when the president apologized, and he was apologizing to folks like Cade and Steve who are going to lose their policies, he said he would try to find some administrative fix to help them. But he can't uncancel their policies, can he?
No, he can't change that. And in fact, there are a lot of insurance companies that go in and out of the market all the time, and there's nothing either prior to the Affordable Care Act.
So how can he help them?
Well, I'm not sure what is going to be offered. Right now, the most important thing for the president to do is to make sure that the website works so that people can actually go online and find other plans that are going to be helpful, and they now will have a choice of plans that will not be substantial.
Okay, which brings us to the last thing I want to get into, Cade. Have you tried to go on the Obamacare website to see if maybe there's something better there for you, or are you thinking...
Well, first of all, let me say, I'm not eligible for any type of subsidy, as he talked about earlier.
Right.
And I have looked a little at the page, but I'm sort of caught between a rock and a hard place, because it's a little more money than I can afford to pay every month, and I don't have the subsidy. So I've got to make a tough decision, and that decision may end up being potentially paying the fine and not taking coverage at all. I'm a 34-year-old, very healthy, have never had any health care problems at all, so I may just gamble.
So you're saying you may just ignore the individual mandate, pay the penalty, which is $95 in the first year, and a guy who had health insurance is going to go without?
Yeah, that's a very good possibility, Chris.
Steve, what about you? Have you gone on the website? What are your thoughts?
No, my situation is that I'm going to have about $9,000 more out of pocket this next coming year just because of this change. So that's $9,000 I don't have to spend in the economy anymore. So that's a problem. Secondly, I'm going to carry coverage because I have 2 kids and a wife, and I believed in my coverage prior, but yeah, now I got to make choices because it's $9,000 more. And to go on healthcare.gov, it doesn't make sense for the people who aren't going to get subsidies. The policies in Illinois are the same on the exchange and off the exchange. So if I'm not going to get a subsidy, I don't have to go to that website. I only go to that website if I have to get a subsidy.
Gentlemen, we're going to have to leave it there.